Welcome to Nurse Educators Now, a podcast brought to you by Collaborative Momentum Consulting. My name is Susan Sportsman, and I'm your host. Today, our guest is Caitlin Yeager, who is the Assistant Professor and Director of the Health Resources and Simulation Center at Ursuline University Breen School of Nursing. I was fortunate enough to attend Caitlin's presentation at the 2025 NLN Summit, and I immediately knew that she would be wonderful to have on our broadcast. And so she was gracious enough to say, yes, she would do that, and we are delighted to have you, Caitlin. Shall we just jump into the questions right away?
Absolutely. Sounds great.
Okay, well, your expertise is in simulation activities, and certainly we all know that they're wonderful for the accurate measure of the level of student competency, particularly the psychomotor skills. However, we know that in real life, nurses must be able to incorporate clinical judgment into each of these skills. So could you share with us what led you to focus on the clinical judgment aspect as well as the psychomotor competencies in simulation development?
Absolutely. So, like many educators out there, we're all looking at the we are still referring to as the new AACN essentials, even though they've been out for almost 5 years now. But at the same time, looking at ways to meet those essentials as well as really diving into that competency component and ways that we can measure competency. And one of the things that within our simulation, I'm also part of the team that does a lot of our psychomotor testing and our kinesthetic testing of skills. And a lot of schools will look at kinesthetic testing kind of separate, as we're just using that checklist, making sure that the student can do the skill effectively. But we wanted to see if there were ways that we could build in competency aspects into not just that simple checklist, but adding components of clinical judgment into that as well. And part of that is so that we can kind of marry those two things together. We absolutely have to do psychomotor development and test to make sure that, students can do a IM or sub-Q medication administration effectively, but we also need to measure competency. And a lot of the things that are evolving around competency are that we need to have that notion that students know how to not only do the skill, but when it's appropriate to do the skill, what background information that they need, and putting it in context, which is really what simulation helps to do. And we can definitely measure that in simulation. But my team was more focused on how do we bring in clinical judgment into the psychomotor skill competency assessment. And so that's kind of where we really took a lot of the focus with that as well.
Well, I think it's wonderful that you are doing that and have worked on that, because I think that is an area that in all the years I've been a nurse or a faculty, we haven't really dealt with that very well. Could you describe some strategies that you use to evaluate clinical judgment as students are performing or about to perform the skill?
Yes, absolutely. So we took one of our traditional procedural checklists. We started with an insulin administration because it's one of the foundational skills our students learn in their first nursing classes in their sophomore year of the program. And it's something that we test all of our students on. And so we took the procedural checklist, but we added in components of Tanner's clinical judgment model. So we wanted to make sure we were adding in the components of noticing, interpreting, responding, and reflecting. So within the noticing component, we were able to give our students actually a mini case study first. So before they perform the skill, they get information on their patient. They get their name, their age, their background, their history, and some of the orders that are provided. And obviously the main order that they have to implement is to administer the insulin. So they are gathering information about their patient, why they might be receiving insulin. So they're looking at their background, their history, right? They're also looking at some of the aspects of prioritizing data or interpreting. So we give them lab values. We give them a set of lab values, which obviously for this medication would be glucose. And we also give them the sliding scale that is provided. So they have to we're not only just saying just give 12 units of insulin, we're saying please review the patient's background and indication for this medication. determine the amount or the dose based on the patient's lab value. And then, so those are the noticing, that information seeking aspect of Tanner's model, the interpreting or prioritizing data piece, and then they're responding, which includes the being skillful aspect of actually completing the skill accurately with all of the psychomotor properties. But it also includes communication. So we built in a component of our testing that the student needs to communicate with the patient about what medication they're receiving, why they are receiving that medication, and any side effects or potential side effects. So they're doing education with their patient as well as performing the skill. So that's the responding. And then afterwards, we do have them reflect on their performance to see what it was that maybe they did really well, things that may have missed during that as well. So we're really incorporating all components of Tanner's model in with the actual psychomotor checklist, as you will, to help promote that clinical judgment aspect, as well as being able to assess their competency within each of those domains.
Well, that is a really good explanation. My experience in students doing competency evaluations in simulation, or just whatever matter we do it, if it is a case study, students will, the first students that do it will say, well, it's this is the dosage. And then they tell everybody else in the line behind them. Do you do anything to make those changes from student to student?
Absolutely, yes. We like to think that our students are just trying to be helpful to others, rather than using the big, cheating word. But yeah, they want to be helpful. They want to tell everybody else what's going on. So we understand that students like to collaborate. And so we do testing stations that occur at the same time. Each 4 of those stations has the same patient, same background information, but a different glucose value. So therefore, it will be a different insulin amount. So they can't just say, oh, just go give her 12 units or go give her 8 units. It's going to be based on whatever scenario they have, and it's random. And so they do have to know, they do have to be able to, now they may say she's going to get insulin. Now, at the same time, during our 4 stations, we actually have 2 that are insulin and 2 that are heparin. So those are also randomized. So same principles as the insulin. It's just that the nomogram is based on the heparin and the APTT values. So a little bit different, but same administration. We actually have a little parade in a sense. We have students in a waiting area before testing, then they go into testing, and then we make them leave. So yes, in theory, they could probably tell somebody that's maybe an hour or 2 behind them, but hopefully not just the person that's right behind them.
Thank you very much. I know I've struggled with it myself, so I think our listeners will appreciate that. On to the next question. In your NLN presentation, you discussed how artificial intelligence played a role in your evaluation strategies, or how you would like it to. And I know we're all struggling with that. So would you share what your thought is about using AI as you move forward into a more complex situation?
Yeah, absolutely. AI is on everybody's mind right now. I'm actually part of a faculty book club looking at this past semester. We've explored 2 different books related to AI and looking at it within higher education. But the NLN Summit this past September was mainly focused on AI. So we did want to bring in a component of that into our presentation. We did use AI for the development of our patient case study and background. So we did incorporate pieces when we were designing. And then also with all of AI, you have to trust but verify, right? That's the common saying. So we developed it, and then we gave the case to some of our expert faculty that have worked within medical surgical, critical care, to review it and make sure that it all made sense. And again, it was a pretty basic scenario. So we were pretty confident, but we wanted to make sure that there was nothing out of the ordinary. So they did review it as experts. But I think in looking at the future of AI, there are already programs out there. We are not currently using one, but there are programs that are being developed and are being implemented that can take large amounts of data and help synthesize and analyze that data. More than just like an Excel report, right? There really are bigger systems that you can use. And one of the ways that I can imagine using some of the data from the psychomotor and kinesthetic exams is right now we're still using paper and pencil I'm sure a lot of listeners might be in my boat too. It's
Mhm.
tedious, but it is what we have. But it would be great to be able to put these on an iPad or put them online, and we're filling out evaluations that then go into a bigger data set. And we can, declassify and make some of the information anonymous so that we're not looking at individual students, but looking collectively at what are the areas that they're maybe really struggling in. As faculty, we look through our cohorts and look through every year and every semester to make sure that our testing is still reflective of practice, that we're still being fair with our evaluations but it would be really helpful as we have more and more students and more data to be able to have AI really do that heavy lift of, are the students struggling with the noticing or the interpreting aspects? And then in the future, it would be really, really great. I mean, right now, AI is being able to analyze static images such as X-rays and things in practice, but getting to the point where it's able to analyze video and really, because we do record all of our students in their testing for their benefit, I always tell them because from our perspective, we only go back and review the recordings if we're having questions about the rubric. I always tell them, you want us to review it because you might get more points if we miss something. And so I try to spin it in that light. And they're like, oh, yeah, of course, record me. I want to make sure I get all the points possible, right? But it's also helpful if we need to remediate anyone to go back and review it with them and say, these are the pieces that we're going to pull out. But going back, being able to have that AI be able to analyze video for things that, again, actions, behaviors. Right now, we're looking at more static, that information aspect, but who knows? That could be in the future as well.
That would be wonderful. I hope that comes soon because that is very difficult. And, use of the spreadsheet to evaluate is awfully time consuming. So that would be wonderful. You sort of touched on this, but I'd like to ask you to talk a little more about it. Usually in simulation, you mentioned that you had 4 different stations, so you got 4 faculty that are evaluating. And I think that's great because, the students get different perspectives from various faculty and that sort of thing. But I also have heard, oh, but Ms. Jones is way harder than Mr. Smith. And so, can you talk a little bit about how you are able to make it so that it is a fair and relative evaluation for all students? It's always hard, I think.
Yeah, absolutely. I mean, I think we can all think back to even our own experiences as student nurses, and we're like, oh, I hope I get this person to grade me and not this person. And so, yeah, I completely, and I think our students still think that. We have some that are easier than others, but we we utilize our lab adjunct faculty to assist with all of our testing as well as our other skill development within the lab space. And all of them are given an orientation to our testing, our processes, our policies, specifically things like what we would like them to do and not to do. For example, we don't want them to give feedback during the test. And we actually don't have them give it immediately after either, just because we want a chance to be able to review everything. And also for the course faculty to really be the one that is sitting down with the student and reviewing those things. But we have tried to, again, standardize our rubric and give all of our faculty training on how to use that rubric, how we're scoring things. Right now, it's more talking through the process and giving them some scripts to read. Everybody gets the same script to read as the pre-brief. So right before the student test, they have a script that they're reading to the student about what it is that they need to do, where they can find things, what the tester's role is, what their role is. And so everybody's hearing the same message for standardization of that. But one of the things I would love to do in all my spare time is to create some testing videos that would be able to be used with our faculty, especially new faculty, to be able to see a mock student performance. So one of us as faculty would, play that role and embed some errors in it and have them score it. And that way, getting
Mm,
practice with how they scored versus what we would anticipate or want them to score. So a lot of other programs use this. Creighton, their competency evaluation instrument, the CCEI,
right.
that's how they train everybody on that as well. So it's similar in fashion to that, but it would be specific to our tests, our exams that we're giving. I think that would be really beneficial to our students, but also to our faculty to understand and make sure that we're really standardizing all of the aspects of testing.
Well, I will hope that you get some sort of grant that gives you the opportunity to do that, because I think it would be very valuable. And so I'll think positively about that possibility for you.
Absolutely.
For our last question, competency evaluation paired with AI may ultimately really improve our ability to document with greater certainty what students, both psychomotor and the clinical judgment. So, I think there's a lot of hope there. And you've talked some about some of the things you would like to do or that you are currently doing, but can you tell us about one advance that you think would be very helpful in your role and in what you do with students?
Yeah. And so we were, talking earlier about the use of AI within the evaluation space and by able to not only analyze and evaluate the learner from different angles that we need, but to synthesize that data. And I think that for a lot of educators who we are always trying to show our outcomes, and especially as we're embarking on the new AACN processes with looking at those essentials and making sure that we're able to document how we're meeting them. And I'm using AACN as an example. I realize that there's other accreditors out there that have similar competencies and things that they are using to measure student outcomes and student success. But I think that is, again, that analysis and being able to show and demonstrate and pull in data from multiple different things. I've given the example today of just one kinesthetics exam that we do, but we do multiple other kinesthetics exams as well as multiple other simulations. And again, we use a lot of rubrics for evaluation. We use mostly with Lassiter's clinical judgment model and rubric for most of our simulations, but we've also dabbled in Creighton, which is why I mentioned kind of both. Those are probably the two big gold standards for simulation performance. But being able to really have analysis of those bigger data. I think the other thing would be to really look at AI as how it's being used in practice and bringing in those components into the nursing lab. So whatever advances are being used within maybe the documentation system of our hospital partners, if they're using AI, if they're using telehealth, if they're using AI for patient monitoring of any sort or triaging, those are the kinds of systems that are really hard for nursing schools to get into because they're so expensive. And our students might get exposed to them in the clinical setting, which is great, but there's no way to really train them on those in the nursing school space. And so what I'm really hoping is that there are greater partnerships that are developed between academic and clinical that can really share those resources so that students are being able to be trained on the same AI tools that are being used by healthcare providers, but in that very safe space of the nursing lab that we're always trying to create, that great psychological safety for them and to learn. And so I think whatever it is that we're using for AI to assist us in practice or assist us with our evaluation, that those systems are continuously being looked at as, how do we make these available in a training capacity for nursing schools and other allied health professions too?
Boy, that is a great idea. And nursing, I think, has been good over the last, 25 years probably, of working with their hospital partners. So I think there's opportunity there, but you're right. It's going to take some work to make it consistent. And I'm sure you have more than one hospital system who may use more than one system to do the documentation or whatever else it is. So great idea in the future. And I'll be willing to bet that is important enough that we will see that before too long. Well, Caitlin, thank you so much. I really appreciate this. This has been great. I know our audience will learn a lot, and we thank you very much for participating.
Thank you for having me. This was great. Thank you so much.